welcome to our October series of our Lunch and Learn featuring Conquer Therapy. We have Megan Wallace here from Conquer Therapy Services, and she will be discussing therapy services available for the teen and adult populations.
It's nice to meet you all. As Linda said, my name is Megan Wallace. I am an occupational therapist at Conquer Therapy Services. Today's presentation is going to be talking about how therapy services such as occupational therapy, physical therapy, and speech and language therapy services can be of benefit to teens and adults with disabilities. Obviously, this is through the Down Syndrome Association, and so a lot of what I'm going to be talking about does apply specifically to the Down syndrome population. But please know that this really does apply to anyone. I believe that all individuals can benefit from therapy services. I'm such a big proponent of that. So, like Linda said, if you have any questions at any point, please put them in the chat, and I will try to answer them to the best of my ability. Also, before we start, I want you guys to know I'm getting over a bout of pneumonia, and so sometimes I do have to cough a bit. So I apologize if I sound a little off at any point. So thanks for bearing with me. I appreciate it. All right, so here's a little introduction to what our presentation will look like today. I'm going to start with a nice little introduction to who Conquer Therapy Services is, who I am, and kind of what my background is when working with the teens and adults population. From there, I will go into each specific therapy discipline that we offer at Conquer Therapy and that teens and adults with disabilities can obtain. So I will talk about the role of physical therapy in optimizing physical health, next speech therapy and their role in enhancing speech and language and communication, and last but not least, occupational therapy's role in promoting an independent, satisfactory, fulfilling, and participatory adulthood. So I saved occupational therapy for last because I'm an occupational therapist and I was nervous that if I started with it, I would talk too much about it. So I will get there eventually. So that's a little bit about what we're going to be talking about. So we'll start with some introductions here. As I said, my name is Megan. A little bit of background information on me. I actually grew up here in St. Louis, Missouri. So born and raised here my whole life. I went to University of Kansas in Lawrence for undergrad, where I got a degree in psychology and sociology. So those perspectives, I think, have really helped me in my career so far. Huge Jayhawk fan, so rock chalk to anyone else who is a fan as well. I came back to St. Louis for grad school, where I earned my doctorate in occupational therapy at WashU. And I ended up staying here ever since and kind of establishing roots, which has been wonderful because I've met so many amazing families and partnered with so many amazing organizations such as the Down Syndrome Association. So it's been a wonderful experience so far. On a more professional level, I kind of got into this career first by growing up with a cousin who was younger than me with Charge syndrome. It's a pretty global syndrome, pretty rare, but this caused him to have difficulties with hearing, seeing, moving, communicating, pretty much everything. And I always had an interest for what he was doing, what the therapists were doing that came into our family's home. And that's when I knew that's what I wanted to do. So from that, I became a care partner for 3 different young women with disabilities throughout grad school and undergrad. And it was an amazing experience. I think having that caretaker perspective has really helped me in my career as an OT so far. During grad school, I did some programming on life skills for adults with disabilities, which was just so much fun. That is like where my passion lies. And now working with Conquer, I do individual, group, and consultative services for adults with disabilities. So this is really a passion area of mine. I am currently running I just got done with 2 groups. I was running 4 groups as of like a week ago at the Down Syndrome Association, 1 on fine motor skills, 1 on life skills, and 2 on social skills. So my social skills groups are still running through the rest of the year. So it's been so much fun getting to work with this population, and I appreciate y'all being here. So, like I said, I am an occupational therapist at Conquer Therapy Services. This is a private practice that's owned and operated by two occupational therapists. Here we have Jamie Schonhoff on the left, and we have Danielle Schenk on the right. They founded this practice on the belief that they wanted to be everywhere in the community where therapists were not. And I think oftentimes you find therapists in kind of the same locations doing the same types of things. And we wanted to be different. We wanted to fill in those gaps and meet those areas that the community really needed. So they are amazing. I will say Jamie here on the left, she has a shared passion for working with the adult population. And so we work very closely together to do a lot of intake work, marketing, all of that good stuff. So she is kind of my right-hand woman in this whole endeavor, which is amazing. Aside from them, we have 15 other therapists on staff who provide occupational therapy, physical therapy, or speech and language therapy services. What's cool about us is that we provide services for individuals from birth through adulthood. So we are contracted through Missouri First Steps. So we are seeing individuals literally from birth. And now we've expanded into the adult population, which is just so fun and amazing. And I'll get into more of like how that came about because that is something new and it was a big endeavor, but it's been wonderful. We have an office in Creve Coeur, but we also believe in the power of seeing an individual in their natural setting. So I am always in my car, as are our other therapists. We're driving around to workplaces, to schools, to homes. We are out in the community and seeing how the individual is performing their everyday activities in their environment. So I think that makes us very holistic and different, and it's just a cool tidbit about us. So specifically as it relates to adult services, before I got to Conquer, I had met with Jamie, the owner, and she had this passion to make sure that we were able to get our adult clients in the door because we are technically registered as a pediatric practice. So Conquer used to only be able to provide services to individuals from birth through early adulthood, typically early 20s. We do take Medicaid through 21. And some individuals who are on their family's private insurance plans were able to kind of stick until, 26-ish. It's kind of a gray area though, and we were seeing that there's just so much need in this area. So after a 2-year process, we have now become an approved Department of Mental Health Home and Community-Based Services waiver provider. This is a huge subject. I actually gave a whole other presentation on what these waivers are, how you get them. That can actually be found on DSA's YouTube page. So if you are interested in learning more about that, you can check out that video. But basically, what this allows us to do is provide one-on-one occupational therapy, physical therapy, and speech therapy services to adults who are 21 and older, who do have an HCBS waiver. Given that these are hard to obtain, and it's a difficult process to navigate, we also meet the needs of this population through other services such as holding group sessions, like I was talking about, how I do some programming at the DSA, conducting caregiver training if caregivers feel like they need a little extra support and assistance to make sure that their loved one is getting the support that they need in their home environment, in the community. We're able to provide some of that training either one-on-one or in a group setting if we're finding that there are commonalities among parents or family members or caregivers who are needing some assistance. We can also provide consultative services to kind of just give our expertise, give some input to help make sure that we are ensuring that the individual is having the highest quality of care and life that they can have. So we do a lot of different services with this population, but getting the waiver approval was a huge milestone for our company. And we are slowly but surely starting to get clients in the door, which is just so rewarding and exciting. So that is a little bit about Conquer. I'm now going to kind of talk about the specific therapy disciplines and how they can benefit teens and adults with disabilities and specifically Down syndrome. What is physical therapy? I think this is kind of the one that most people know the most about. I think when you think of an individual who gets injured or gets surgery, they have to go to physical therapy. Um, Physical therapists help individuals improve their quality of life through hands on care, education, and most importantly, what makes PT is prescribed movement. That's what we call it. Being able to determine a set of movements, exercises that is intended to help an individual gain, restore a skill. So physical therapists do many different things, but among those include improving and maintaining mobility and muscle strength. And when I say mobility, I mean for individuals who are ambulatory as well as individuals who are non-ambulatory. There is strength and skill that goes into either types of mobility, and that is something that our physical therapists can help with. Improving balance and coordination. This is such a big area, preventing falls, ensuring safety at home and in the community. Optimizing physical health and wellness, just overall general well-being as we age, thinking about nutrition and health and wellness and fitness, all of that stuff. I'll get into more on that on the next slide. Um, Stop or slow the loss of function. As individuals get older, we start to see that abilities decline a bit, and that's the natural part of aging. But being able to get in there and stop it or slow that progress to make sure that teens and adults are able to maintain their function for as long as possible is super important. Managing chronic pain, Down syndrome in particular, I know that chronic pain in the neck can be a common condition that's experienced, and coming up with strategies for how we can manage that pain throughout the day to make sure that participation is still possible. Preventing chronic conditions from developing or worsening. Each diagnosis has its set of what we call comorbidities or other conditions that kind of come along with it. And so if we do find that there are chronic conditions that are preventing our day-to-day tasks from being completed, working on how we can prevent those from developing in the first place or worsening to a point where function is starting to get lost. And last but not least, learning new and improved ways to complete everyday tasks. Just because we're in a habit of completing something doesn't mean we're doing it the most efficient way possible. And we might be putting strain on parts of our body that don't need it, leading to a whole other host of issues. So thinking about how we can modify our environment, modify the task, if we're finding that we're needing to do some of that. So that's a little intro to PT. Specifically, some areas of focus. I consulted a lot of evidence specifically in relation to the Down syndrome population because I was curious. And these are areas that our physical therapists focus on, but there is so much research to back what we're doing. So one big area of focus, as I talked about, was health. So individuals with Down syndrome do have a higher prevalence of osteoporosis, cardiac conditions, obesity, as well as like gait disorders. And ataxia is, it's like that movement pattern is not really able to be carried out as well. So thinking about how all of those conditions can affect our health and our day to day. Going hand in hand with that is mobility. We find that among individuals with Down syndrome, there's an increase in compensatory movement patterns due to decreased gait velocity, so how fast we're able to move, shortened step length, so we're not stepping as far as we should, and having a larger step width. So all of those movements, although we might be able to successfully get from one place to another, they may be causing strain on another part of the body and causing us to compensate. So working on mobility is another great area. Fitness, there has been a lot of research that's found that training programs, specifically those that include exercise, significantly improve cardiovascular fitness, endurance, and muscle strength among adults with Down syndrome. So having that prescribed medicine of movement can be really beneficial for an individual's health, well-being. So these all kind of tie together, which is cool. Balance is also usually impacted for adults with Down syndrome. Decreased standing balance, static balance. Static balance is when we're just sitting there, not doing anything. And then dynamic balance is when we're reaching, bending over, leaning. We think about, bending down to pick something up off the floor, or reaching down to tie our shoes. Those are all part of our dynamic balance. And then postural control. This is a huge area. When we think about our abdomen and our core, that is the center of our body, and that's kind of what keeps us balanced and centered. And so if we're having poor postural control, that can contribute to some balance difficulties, which can affect our health. So there's that. And then nutrition. We find that individuals with Down syndrome have decreased consumption of fruits, vegetables, whole grains, and dairy, and an increased consumption of meats and sweets. So talking about different dietary plans, sorry, I cannot think of the word, to talk about how we can make sure that we are giving our body the fuel that it needs, to make sure that we're as healthy as possible. And last but not least, cognition. This is a huge one that we'll kind of talk about across different therapy settings. We find that prescribed movement increases levels of vigilance and decision making. And resistance training improves our executive function skills, which is our cognition, and those higher level cognitive functions such as memory, attention, organization, planning. Such a huge part of our day to day, and we need those cognitive skills to complete all of our other tasks. Our working memory, and then our frontal lobe activity. So our frontal lobe, it's what's here in the front of our brain, and that's really what controls a lot of those higher level cognitive skills. And it's pretty closely associated with forms of dementia that we often see come about with Down syndrome. So those areas of focus are all they're all supported by research, which we like to be evidence-based in everything that we do. And we want to make sure that there is research out there to support what we are doing and why we are doing it. I don't mean for any of this to be scary or overwhelming. It's just kind of to give you an idea of the fact that we are here to help, and we would love to help, and there's room for us to make some progress here. So going off on that, these two kind of go hand in hand, some common interventions. So if we did see a teen or an adult come in who needed some physical therapy, we might work on creating a wellness program together. Wellness programs are so great because they're individualized and they're tailored specifically to the individual receiving the service. These include different nutrition, exercise, just different plans for making sure that we are meeting our health, physical, nutrition goals and needs, to make sure that we are living a healthy life. So wellness programs are super helpful. And I'll kind of jump down here to number 3 with home exercise programs. I think this is what individuals think of a lot when they think of physical therapy. They gave me a set of exercises, I'm going to go home and do them. And that is kind of exactly what this is. So if we're finding that there are certain exercises that we're needing to perform to improve balance, improve strength, improve gait, that these are being worked on at home, because just because we're seeing someone for 1 hour a week does not mean that more progress can't be made in that off time. So home exercise programs are really great, really common. Working on strength, balance, and coordination exercises. So similar things that would be in our home exercise program, working on them here in the clinic with our therapists who are really well-versed in these types of areas. Gait training for individuals who are experiencing some difficulties with their ability to get from point A to point B, whether that be with their legs or wheel mobility, either can require some help and assistance, which is great. Caregiver training, you'll find this kind of across therapy disciplines. We love to connect with our caregivers and provide tips, strategies, training to make sure that they feel like they have adequate support to provide care at home and in the community environment. So this can include, how do I do certain exercises, or help my loved one with certain nutritional programs, or carry out this wellness program, or how do I make sure that they're safely transferring out of bed to the bathroom, into the shower. All these different areas can be targeted through caregiver training. And last but not least, this is another one you'll kind of find across therapy disciplines, adaptive equipment use and training. So adaptive equipment is just a fancy way of saying devices, tools, pieces of equipment that can be used to help someone make sure they're carrying out a task well. So in terms of physical therapy, we can think of walkers, wheelchairs, canes, but we can also think of other like daily equipment, such as like grab bars in our shower, a raised toilet seat, just to make sure that we're as safe as possible in our home environment. So that's a little bit on physical therapy. They are the movement experts. They focus on everything dealing with the body, our muscles. That's what their expertise is. So another area I want to talk about, if maybe one-on-one therapy services isn't super needed and we're just trying to improve overall health and wellness and well-being, sports and recreation opportunities are something that we really, really, really recommend. Not only is this so great for our physical health, but this is great for our socialization, being able to be a part of a community, connect with peers. This can improve mental health and physical health. So we recommend these for pretty much anyone, but just a couple things that are out there in the St. Louis community. The Down Syndrome Association has such great programs that they offer. They have partnered with Buddy Up, and this is a health company that does a lot of training for fitness. They have Buddy Up Tennis, which is a 90-minute tennis and fitness program. Buddy Up Fitness, which is 60-minute HIIT style workout program. So that's high intensity interval training, which can be really, really, it's hard, but it's good for the body. And on YouTube, if you're looking for something a little more relaxed, low key, they have a workout with DSAGSL series on their YouTube channel. So it's so fun. I went through and watched the videos. You can stop and start them at your own pace. You are able to take breaks. You could even call a friend over and do them together. You don't have to complete all of them, but it's just a nice way to have some guided, structured movement and exercise without even having to leave the home. So, and you could also find other things on YouTube as well. But I think DSA's series is really, really cute and fun. Of course, we're here for the DSA, and we love the DSA, but there are other organizations in the St. Louis area. St. Louis ARC is another amazing program for individuals with disabilities, and they offer so many sports and recreation opportunities. I think I would be remiss if I didn't talk about them. ARC United, it's kind of a competitive league. So for our big sports lovers, they have softball, basketball, pickleball, soccer, and kickball. Which is fun. And then they have individual leagues where you can play any one of these sports, golf, tennis, bowling, soccer, basketball, and softball. They also offer a dance club for our dancers, as well as walking club, a little calmer, and you could even, buddy up with a friend. And then yoga and meditation groups, which I think are really fun and again, support that well-being and that mental health a lot. Outside of that, there are some other organizations here. I was talking to Linda before we started, and I think I'm finding that most individuals on here, their loved ones are a little older than 21. So some of these might not be as relatable, which I apologize about. But for those who do have a loved one under 21, there's a great program called KEEN, Kids Enjoy Exercise Now. That's a great exercise program and organization for individuals with disabilities. Team activities for special kids is TASK. Spensa does like a soccer league for individuals with disabilities. Of course, we love our Special Olympics. And then Challenger Baseball is a baseball league for individuals with disabilities. I used to volunteer with them. I thought it was younger, but I wasn't able to find an age range on their website, unfortunately. But I've been a part of it. It is such an amazing organization and people absolutely love it. So just thinking about ways that we can promote movement, exercise, physical activity, and wellness throughout the day, even if we're not getting therapy services. So little tidbit there. Now I'm going to head into speech therapy services. Speech therapy, also called speech and language therapy, it's done by a speech language pathologist, and those are commonly referred to as SLPs. So you'll probably hear me say SLPs throughout this. Our SLPs help individuals who are experiencing communication and swallowing difficulties in various areas of life. So speech sounds and articulation. This is talking about lisping, pragmatics, being able to use communication appropriately in social settings. Our voice, so our pitch, our projection, our level, how loud are we talking or softly are we talking? Our clarity, how are we able to articulate our words and let people know what it is that we're trying to say? Fluency, the flow of speech, stuttering and cluttering. I'll talk about that a little bit on the next slide. Cognitive communication. I said, we're going to talk about cognition across all disciplines, and it's really like such a big part of what therapy is. There's such a strong link between language and cognitive communication, and so you might find that SLPs will target some of these cognitive areas, such as memory, attention, organization, planning, problem solving, sequencing, those higher level cognitive tasks that I was talking about. And last but not least, feeding and swallowing. If we're having feeding difficulties eating, chewing, swallowing, this is something that SLPs can address as well. Specifically as it relates to individuals with Down syndrome in the teen and adult population, some areas of focus are receptive language. So what we find, what the research has found, is that our receptive language abilities, so our ability to understand what's being spoken to us, and our language comprehension, so our understanding of language, actually starts to plateau when we reach adulthood. It increases when we're kids, and then it starts to kind of go on this straight plateau. And we also find that our language comprehension, so our ability to understand language, is correlated with our mental age, which means that as we get older and maybe our cognitive abilities decline, our ability to understand language actually decreases as well. And we find that with sentence length and grammatical complexity, as both of those increase, our understanding decreases. So if a sentence is longer or its grammatical complexity is greater, we're going to have a harder time understanding what's being said to us, and therefore having a hard time communicating with individuals because we can't take in what they're saying, process it, and then have an appropriate response back. So receptive language is such a huge area of language, and something that our SLPs love to target with our teens and adults. Fluency is another really, really, really big one. Research has found that stuttering and cluttering, which I actually never heard of cluttering before this, but it's an irregular, jerky speech rate. So you might find frequent pauses, or talking really fast and then talking really slow. Both of those types of speech patterns occur at a higher rate compared to neurotypical populations. So anywhere between 10 to 45% of individuals with Down syndrome experience stuttering or cluttering versus 1% of the neurotypical population. So this just goes to show that this is an area where we might be able to offer some support. Expressive language, this is kind of on the other end of receptive language. This is our ability to produce speech and communicate with others. So research has found that individuals with Down syndrome have reduced intelligibility of speech, so a difficult time speaking with clarity so that our speakers are able to understand what we're saying. Expressive vocabulary, so finding the right words to express what we're trying to say. And prosody, which is our rhythm, our tune, our intonation, those different parts of language that really help a speaker understand what we're trying to say. So there's a lot of great research on that. And last, I'll end with our augmentative and alternative communication devices. This is kind of a newer area for Conquer, but we have had so much interest lately, and we've had so many families come in and seek out this service. If we're finding that individuals are nonverbal, or if they're experiencing difficulties verbally communicating their wants and needs, we can look into an AAC device. And this specifically relates to Down syndrome. There's a lot of research out there about Down syndrome regression disorder. And if it's not that, just other types of decline that suddenly come on as individuals with disabilities, not just Down syndrome, age. And this can cause a sudden onset of language disorders, in addition to sudden behavioral symptoms and really a loss of independence and autonomy in daily tasks that we saw before. So oftentimes this does include a regression in language. And at the end of the day, we just want individuals to be able to communicate and express their wants and needs. That is There's no greater power that one can have than having their voice, and a voice can be in many different ways, whether it's with our mouth or with a device. Devices are such a great route to go down, and they're something that we have explored a lot with our clients, and they have proven to be so effective and just improve quality of life, which is amazing. So we can prescribe an AAC device, work on training, make sure that this becomes like an extension of the self, to become a way to communicate. We call it your words. So even if it's on a screen, it's still your words. So some common interventions that kind of go hand in hand with those areas of focus, talking about our fluency and articulation skills. So working on some of those expressive language skills, which ties into our second one here, being able to go back here and talking about how can we increase our intelligibility? How can we increase our vocab, and make sure that we are using like appropriate rhythm, tune, and intonation when we are communicating in everyday conversations with peers. Our receptive language skills, so being able to understand different sentence structures, different words, different grammatical types of phrases that are being said to us. Caregiver training, if we're looking for tips and tricks for how to best promote communication in the home or the community environment, whether that be verbally or non-verbally with a device. Getting some of that assistance can be really beneficial. Our social communication skills and our pragmatics, how we're using language in our everyday social interactions is so important. And this is something that we work on so often with our adult clients. It's super helpful because you think about how our social communication skills affect our everyday life, not just making friends, but finding and obtaining employment, finding a romantic partner, being able to handle situations like that, and just being able to interact with peers on a day-to-day basis. That's the core of what makes us human, our everyday interaction. So this is such a great area that we can target through speech therapy. Executive function skills, again, talking about those cognitive skills, coming back to those, such a huge part of our language. And we find that if we can improve some of those cognitive functions, we can also simultaneously improve our language. And last but not least, again, talking about being able to prescribe and provide training for those AAC devices. And last but not least, I will get into my area of expertise, occupational therapy. After this, I'll open up the floor to some questions and answers. So thanks for hanging with me, guys. I appreciate it. All right, so I would say occupational therapy is probably the most gray area out of all the ones that we offer, just because when we think about physical therapy, we kind of think about the physical body and movement. When we think about speech and language therapy, we think about speaking and communication. I like to say that occupational therapy is everything that's in between that. So, occupational therapists, in a sense, help individuals gain the skills they need to participate in everyday tasks that they want to do and need to do to live a fulfilling, satisfactory, and independent life. So, that's a lot of words, but basically, what it comes down to is this: the word occupation. I think a lot of times when people hear occupational therapy, they're like, can you help me with my job? And the answer is yes, we can. But an occupation is anything that occupies time in your day. So your job might occupy time in your day. And if that's an area that an individual is needing help with, then we will work on that. But this ranges from across so many different areas, and those are listed here. So it ranges from one end of our basic activities of daily living: bathing, toileting, dressing, eating, functional mobility, which just means getting from one place to another. Those are everyday activities that we are doing and that we need to do to be able to live a fulfilling life. And then we move on to our instrumental activities of daily living. This is really where we target our adults and teen population, just because these are those higher level everyday tasks that we need to do if we want to be independent and really like live out our adulthood. So when you think about it, when you're an adult, you got to manage your money, you got to manage your medications, you have to cook meals for yourself, you have to do laundry, clean up after yourself, shop for groceries, shop for medical equipment, shop for clothing, make phone calls with different individuals. These are these instrumental activities of daily living that we often see teens and adults have a little bit of struggle with, and that's why we're here to help. In addition to that, we have our fine motor skills, which is our small movement of our hands and fingers. We think about those for dressing. And for instance, if we need to button a shirt, if we need to zip up a pair of pants, tie our shoes. But aside from just dressing, even handling different materials, we use our fine motor skills all the time in our everyday life. And you will find that if you start noticing what you are using your hands and your fingers for. Sensory processing is such a huge area. Every single person has different sensory processing patterns. We all have a different way that we receive, process, and then respond to incoming sensory information from our environment and from our internal body. So, for instance, I am very sensitive to light. So I have heightened visual responsivity. Bright lights bother me a lot. And so I receive and process and respond to that differently than someone else. And so that's true for all of our sensory systems. Individuals have different patterns, and we can kind of look at those and come up with strategies for how we can address that. Adaptive equipment, kind of like what I was talking about, physical therapy. We are able to look at tools, devices, and equipment that can help promote participation. There's so much out there. I don't even know where to begin. Again, we'll go back to the dressing example. If we're having a difficult time buttoning our shirt, there's something called a button hook that we can use. If we're finding that it's difficult to get in and out of our shower, again, we can install grab bars. If we're having a hard time putting our socks on, there's something called a sock aid, which actually prevents us from having to put our sock on ourselves. And it's this really cool, handy dandy tool. So there is so much out there, and a plethora of materials and tools that we like to tap into for our clients. Executive functioning, again, getting back into our cognitive, higher level skills that are needed to carry out daily activities. And last but not least, our caregiver training. So talking about what are appropriate cues we should be giving, how much physical assistance should I be providing, and how, and different cognitive strategies that can be used when we're starting to maybe see a decline in cognition as our loved ones do eventually age. So just like I've done for the other therapy disciplines, talking about some areas of focus, independence is such a huge one. And this is one I work on with so many different teens and adults. A systematic review, it's a really high form of evidence, found that most adults with Down syndrome really want to become more independent and exercise their human rights. So there is this need and this desire for autonomy and self-determination and being able to speak your truth, live your truth, and do things for yourself. I think that there's nothing that preserves dignity more than this. We help our clients promote independence and make sure that they are able to be self-determined and make decisions for themselves and be an active participant in their own life. So that's a big area of focus, one that I'm super passionate about. Going over here to executive function, research has found that adolescents with Down syndrome have impaired shifting. So the ability to transition between topics, activities, just experiences in our head. Planning, so organizing and coming up with an idea for what one wants to do. Problem solving, so being able to solve a problem that has come up. Working memory, being able to store information in our head and use it immediately. Inhibition, so holding back. We find that impulsivity is a little more present. So kind of like acting without thinking is how we view that. And perseveration. So that's kind of like being really focused on one thing kind of over and over again, and like feeling stuck on a certain topic or idea or activity. So executive function skills, like we talked about, have such a big impact on our everyday functioning. And these kind of go hand in hand with our IADLs over here. So those instrumental activities of daily living, I was talking about those higher level activities those call on these executive function skills here. And if we're finding that we're having difficulties with our executive function, we're going to have difficulties with those instrumental activities of daily living that are so necessary and a big part of adulthood, like managing our medication, cooking a meal, doing the laundry, navigating transportation systems if we're not using our own, those types of areas. Cognition. I think most of us know the correlation between cognition and dementia and Down syndrome. Pretty sad statistic and shocking. Anywhere between 5.7 to 55% of individuals with Down syndrome experience some form of dementia between 50 to 59 years of age. Cognition is such a big area for occupational therapists to focus on and work on. It was like an entire semester in OT school. That's how important it is. So we know different tools, strategies, tips, and tricks to help the individual be as independent as possible for as long as possible, and help caregivers make sure they have the support and the skills needed to support them in a home and a community environment. Social skills. I thought this was really interesting. A study found that individuals with Down syndrome have a greater difficulty recognizing inappropriate social situations versus appropriate ones, identifying what a friend is versus a non-friend when presented with different scenarios, and distinguishing between friendly and unfriendly behaviors. So seeing that some of those abilities to decipher between right and wrong, appropriate and inappropriate, is a little bit affected with individuals with Down syndrome. And, I am working on 2 social skills group, and we have so much fun talking about different topics, real life skills that translate to everyday interactions, which is just so fun and awesome. And last but not least, transitioning. So transition to adulthood is like my passion. I love it so much. That's kind of how I got into this area. But I also recognize there's other transitions within adulthood. In transitioning between different life stages, there was a study with families with a loved one with Down syndrome, and they found that these transitions are described as being unexpected, stressful, and challenging. Despite super great planning, they often go awry and cause unpredictable outcomes. So we are here to help individuals through different transitions through life, whether it be transitioning from living with parents to living in a different environment, whether that be transitioning from school to adulthood and employment. All sorts of different transitions happen in our adulthood, and it's hard to navigate them and feel ready and well equipped to make that transition. But occupational therapists are here to help with that. So some common interventions going off of that: IADL training. So talking about how can we improve our ability to manage our medications or cook a meal or be safe in the community. Occupational therapy is very doing based. So if we're working on medication management, we are actually practicing managing medications. So might not be real ones. We use little beads a lot to represent pills, but we're very hands-on in our approach, and we really like to make sure that we are doing. Second, transition to adulthood and routine establishment. So again, trying to find routines and a sense of predictability as we are transitioning between those different life stages, and supporting an individual and making sure that they feel supported in that. Social skills training, kind of like what I'm doing in my groups, making sure individuals have the skills that they need to use appropriate pragmatics and engage appropriately with different types of peers in different types of settings and environments. Executive function skills, so working on improving memory, attention, planning, organization, problem solving, sequencing skills. And we do that in very fun ways through like games, activities, all of that good stuff. Different cognitive strategies if we're finding that how do we work on how to remember something. I can't remember to take my medication every morning. Thinking of what are some strategies we can do. Are we gonna target memory here? Are we gonna target some adaptive equipment that we could maybe use and implement in the environment to promote success in that activity? So cognitive strategies, again, there's so much out there that you can do for this, and we have a plethora of knowledge in this area. And last but not least, our adaptive equipment use and training. So, like I was talking about earlier, there's so many pieces of equipment out there that can help us be successful in a task. It does not mean that you're no better at it because you need something to kind of help you along in that process. It just means that we're getting the support that we need to be successful in what we're trying to do. So, that is my spiel on the 3 different services that we offer at Conquer. If you know anyone, if your loved one or you know anyone else who is needing assistance with communication, daily living skills, or movement, we are here to help. Our occupational therapists, physical therapists, and speech and language pathologists are so amazing at what they do. We have really dedicated a lot of time and effort to meet the needs of our teen and adult population. And we are just here to help in any way that we can, whether that be through individual services, group services, consultation, caregiver training. We really want to be here to help you.
Thank you so much, Megan, for presenting. We really appreciate all of your knowledge and the collaboration with Conquer Therapy. So we greatly, greatly appreciate you.